Hi guys, and welcome to Thankful Thursday again with Rachel and myself, Kel. This week's topic actually came in the form of a message that was sent to Rachel, and I think our videos for the last couple of weeks have been following a bit of a theme, as you're about to see. So the message Rachel received said, "How do you stop yourself from getting too attached to therapists? I find that anyone who shows the slightest amount of care, I sort of become obsessed." Brackets, wrong word really. But yeah, I don't understand why I do it. I did it at school too with teachers, and I don't know if it's common or if it's just me. And it can influence my behaviour and mood around that person because I can become upset just to gain their attention, and it is a difficult struggle to keep myself in check and honest while trying to deal with my eating disorder. So when I look at this, I kind of see two areas really, and the first one is that first line: how do I stop myself from getting too attached to my therapist? And the second one is the point about becoming upset just for the attention of that therapist or a teacher, as you mentioned as well. So really, if I start with the first point regards getting too attached to a therapist, I think the difficulty in this lies in that you need to really trust your counsellor or your therapist in order for your counselling or therapy to be constructive. And due to the nature of that, I would think it's quite common for people to become really quite attached to their counsellor or their therapist, particularly if it's unusual for you to trust people, which seems to be a common theme among the people that I know with eating disorders. So please don't feel alone in thinking like that at all. And I would hope that as you continue your counselling or your therapy, that you're sort of developing as a person, and you'll realise less and less your need to be dependent and attached to your therapist, and that you can sort of do these things alone. And I think personally that the attachment does come from that fear of not being able to do it alone and then being the only person you can go to. And really, they're the sorts of things that you should be building, sort of a network around you of people that you can go to that aren't your counsellor and therapist slowly throughout the course of your therapy, so that when that does stop, there are other people there and you have got other people that you can go to. If you do think that you're becoming too attached to your therapist or your counsellor, I really would bring this up with them. They're probably going to have heard it before, to be honest, and they can hopefully help ease your thoughts about that and see whether it's something that you perhaps need to work through in your counselling or your therapy, or whether, like I just suggested, it really is just part of the process and you'll find that there will become a point when you don't feel like that anymore. So moving on to really the second point that came in this message, which was the point about being around this person influencing your behaviour and your mood, and you're becoming upset to really gain attention. I think the first point I want to make about this is that wanting and needing attention is perfectly normal. We all need attention from people. We get attention from our parents, our friends, our siblings, people at school, people at work. If we're older, we get attention from everywhere, and it's really normal to want that sort of contact with people. And if you're not getting it from the places that you perhaps should get it, for example, if you feel ignored by your parents, or you don't have many friends, or you find it difficult to be open with people even, then I think it's quite understandable that you do sort of have this issue with the one person that you have a good relationship, hopefully, with, which is your counsellor or your therapist, or, as you did say in some circumstances, your teacher. So it really is normal to need attention, first of all, and then after that, I think the problem really comes with this in that you're saying perhaps that you're getting upset when you're not necessarily having an issue at that time, and it's perhaps also going to affect you dealing with your eating disorder because you are dealing with whatever the other upset is instead. And obviously it's good to be able to use the time with your counsellor or therapist constructively, which this is perhaps interfering with. And again, like I said before, I really would encourage you to talk to your counsellor or your therapist about this, because I do feel it's something that you can work through for a start, and I think it's probably also, in some cases, they're going to know when you're not being 100% truthful as well, so they might not be that surprised, and it could be positive that you're able to verbalise that. And if you're becoming upset around this person for no other reason other than that you're around that person and you like the attention of being upset around that person, that's really a problem in itself, because if it affects your mood and you become upset around them when you were otherwise happy prior to seeing them, that's obviously not very constructive, really, if you can see that. And obviously your counsellor or your therapist is going to be wanting the best for you, and they aren't going to want you to feel upset just because you've seen them. So I really would encourage you to just be open about that. And in terms of how to keep yourself in check, I think you do have a choice to make with it, and I think the question that this brings up to me is maybe you're bringing up these other upsets to avoid the real issues, perhaps. And if that's true, then that's something really to deal with as well, and that makes it understandable as well. So really, I guess what I'm saying is that you're not at all alone in feeling how you're feeling, and it's okay to feel how you're feeling, but I'd also encourage you to discuss this with your counsellor or therapist. And I understand that it might feel awkward, but they've heard all sorts before, and I'm sure it's not going to be the first time somebody's said it to them. If you're perhaps finding it too difficult to verbalise your concerns, then something that I always do is I write, and I find that really useful because it allows me to sort of work through it clearly, so I can go back over it and check that it says exactly what I want it to say before giving it to them, and they're also then going to get a clear understanding than perhaps the emotional ramblings that they might get if I hadn't have written it down. And that might be more constructive in this instance, because what's really important is that you do deal with your real issues, and you do learn to become independent and happy, hopefully, and that you do deal with your eating disorder rather than that sort of taking a backbench to you becoming upset for gaining attention or because of your attachment to them. So I don't know how useful this video has been, but hopefully that answers your question. And as always, if it hasn't, do post a comment and I'll either reply to that or I'll make a second video. So until next week, guys, take care. Goodbye.